Okay. Well, first of all, thanks for taking the time to come to the session at the end of a very busy but yet very exciting and interesting day. It's very nice to know there's so much interest in this piece of work. So I'm going to describe some work we've done in Manchester in collaboration with the University of Manchester to develop what we've called our Manchester Measuring Inequalities Toolkit. I'm going to explain the rationale and purpose of a toolkit, the content, how we developed it, what the current version of a toolkit looks like, and some reflections on the process and lessons learned. And there'll be an opportunity for questions and discussion following the presentation, but obviously I'm around for the rest of the conference as well if anybody wants to pick up anything afterwards. So this is, I'm doing a presentation, but again, very much it's a partnership with my colleague Eliza Varga, who's a public health researcher at the University of Manchester, who needs to get the credit for doing most of the work on this. That's the original slides on that. So this toolkit was developed as part of our Making Manchester Fairer programme, which is our 5-year action plan to address health inequalities in Manchester. The action plan itself is very much based on what our residents and staff from a range of organisations have told us, as well as the evidence from what's worked in the past around health inequalities. It also incorporates the city's anti-poverty strategy, which just kind of recognises that link between poverty and health inequality. The actual action plan itself is a combination of 8 themes, which you can see in the boxes there, which very much reflect the social determinants of health, and 4 ways of working, which are in the speech bubble at the beginning, which are things which community groups and trusted organisations have told us as a council and as public services that we need to adopt in order to better involve them and the people they support and represent. The action plan itself for delivery is based on a series of principles, at the heart of which is a commitment to monitor and evaluate everything we do in order to ensure that we are making Manchester fairer by narrowing gaps within Manchester, as well as within and between national and regional averages, as well as make overall improvements in health outcomes over time. And the Measuring Inequalities Toolkit is part of our commitment to help and support people to do that in the most effective and statistically robust ways possible. So why do we need the toolkit? Firstly, measures of socio-economic inequalities are important markers for health and social policy and society in general. So it's just generally a good and right thing to do. If we are doing that, then it's important that the indicators and tools which we use are both accurate and presented in a way that minimise the chances of misinterpretation. And through doing all of that, the purpose is that it will support better quality decision making by allowing a consideration of inequalities in performance measurement and assurance that runs alongside data on whether our health outcomes as a city have improved overall. In terms of the actual the production of a toolkit, it's a genuine partnership between the City Council, Department of Public Health and the University of Manchester, and we're very grateful for the funding, the financial support that we receive through policy at Manchester as part of the UKRI Research England Policy Fund. The toolkit is primarily designed to equip information analysts from across health and care system with a comprehensive understanding of inequalities measurement and how they can be used. However, we hope it will be valued to anybody with an interest in health inequalities, including policymakers who need to be able to understand, interpret and act upon the data which they may be presented with. The toolkit itself, as I'll show, is modular in design. It doesn't need to be completed within a fixed time period. It's completely open access and people don't need a learning account or a password to access it. Meaning that users can dip in and out of a toolkit and return to it at any point in the future to refresh their understanding of a concept or remind themselves how to calculate or interpret a particular measure. These are the modules within the toolkit. There are 7 modules of increasing complexity, from a basic introduction to epidemiology and inequalities measures to more advanced measures on inequality. All the modules end with a self-test, which can be used by people to help them assess their learning. In terms of the actual generation of content, it does draw on the previous work of, in particular, the Scottish Public Health Observatory and Public Health England, in terms of some of the material which they produced, but it utilises that material, but brings it up to date using more interactive online methods for delivering the training material. The initial content was produced by the University of Manchester, but crucially, the actual content was refined by a co-production team drawn from partner organisations including the Council, our local care organisation, NHS Greater Manchester, ICS, and also the OHID Local Knowledge Intelligence Service for the North West. So it was, a lot of people contributed to the actual content in terms of refining and building that content. And it, as I've mentioned, it includes video links and all sorts of different kind of ways of appealing to different learning styles, both visual and auditory. And we do use local examples wherever possible. So these are some of the inspirations of people who've kind of been working on this topic for as long as I have, may remember some of these things in terms of the material. The material itself is still incredibly useful. So we're not saying that the information in any of these things is any way out of date, but we've essentially brought it up to date from essentially static documents, made them more interactive, of course moved it online, and kind of just tried to generally make it more kind of visually appealing as a training tool. Once we developed the initial content generation, we undertook a structured review of the toolkit to understand people's opinions, both of the content of it and the format of the toolkit, and to identify any potential improvements that can be made. We involved people from different partner organisations and different skill sets. So there were analysts, the project managers, commissioners involved in that process to represent the wide range of potential users. We gave all the people participating a randomly allocated module to look at, and then at the end of asking them to complete that module and then provide feedback via an online tool, both in terms of the practical operation of a system, so did it work, did it fall over at any point, but also in terms of the content and the material itself and kind of how understandable, relevant and usable it was. In terms of the feedback we got, particularly on the content, very positive. It's perceived to be high quality, well received, useful and relevant. Admittedly, a small sample of 10 people, but nevertheless, the feedback was very consistent on that. Most people found the kind of the range of materials used, so the kind of embedded YouTube videos, for example, were really useful. Also, some of the quiz sections at the end were found to be really helpful in terms of consolidating their learning, and also very strong feedback on the simplicity, clarity and conciseness of the tool and its kind of professional look and feel. But as with all these things, and which is what we wanted, we got some suggested improvements that would kind of improve people's experience of undertaking the toolkit. So more information about further reading, perhaps a little bit more information on the mathematical calculations, some standard set of definitions that they could use, and maybe changes to the length of the modules in some case. So we took all of that, kind of built that into the toolkit, and this is what the current toolkit kind of looks like. So although it's very rooted in Manchester, so you've got the image of Manchester there showing the new and the old side by side, which is obviously a very kind of one of the key features of Manchester. All the material in it is generally replicable to any context, any part of the country, any kind of service. We're just in the process of moving it to the university's open access training portal. But if you Google Measuring Inequalities Toolkit, you will find a link to it, and it's there now to be used. So we've still got to move it to a different kind of part of the university's platform, but it is there, it is ready for anybody to kind of use who wishes to do so. So in terms of the kind of next steps, as I say, we formally launched it at a Health Equity Network national webinar last week, and I'm not sure if anybody was on that. The next step is really to try and build it and embed it in professional development and training programs for analysts and other groups. And we're looking at working with people across the system, in our acute trust, in our local care organisation, in the council, to really kind of embed it as something which people should do as part of their ongoing professional training and ongoing development. We're also keen that it's a living resource that adapts in response to user needs and opinions. So all users that have completed the toolkit are directed to an online feedback survey, And at the end of the survey, we've asked people to whether they'd be willing to provide us with their email address if they are interested in helping us to participate in a follow-up survey in 6 months to help us to understand further about how it's actually been used in practice and how well it was received amongst those users. And that will help us to gain the long-term benefits of the training, which, as I've said, is about the extent to which people are thinking about inequalities as a measurement alongside a whole range of other things. So finally, in terms of kind of lessons learned, firstly, I think there's genuine support and interest in the toolkit. The launch event we had had 135 people on a webinar, which was very, very positive feedback. Co-production is really important. It wasn't something that we just built and then handed out. We did involve people both in the generation of the content and then also kind of continuing to refine the content as we go around by getting people to actually test it. But that all takes time, and there were several delays at which we delayed the formal launch just for that reason. But we felt it was so important that people felt involved and engaged with the work that it was justifiable to kind of delay the launch in order to do that. And finally, it is this thing about building this training into the measurement of inequality, into professional development programs, CPT activities, for health and care analysts, but other professionals as well, including public health specialists and practitioners. So it's not something which sits outside their routine ongoing professional development, but something that kind of sits very much within it. And the extent to which we've been successful in doing that is one of the key measures of the programme itself. So finally, as I've said earlier, just to kind of formally acknowledge the support from policy at Manchester, University of Manchester, who were able to kind of fund this. Without that funding, we probably wouldn't have got the work off the ground in the kind of way we do. So we're very grateful to their support. So yeah, happy to take any questions from that point. Thank you.
Thanks so much, Neil. That was really interesting. I think we don't have any questions through on Slido at the moment, so I was just going to check if there are any questions in the room. You might just have to wave your hand because my eyesight's not good. While you're thinking about that, I'm going to take chair's privilege and ask a couple myself. I was just really interested to hear about the co-production that you mentioned. I just wondered if you could explain a bit more about how you set about establishing some of those relationships, because obviously that takes an awful lot of time and energy, doesn't it? I wondered if you could talk a bit more about that.
So the Making Manchester Fair programme itself, as any programme, lots of kind of themes within it. Monitoring evaluation is a formal theme within the Making Manchester Fair programme. As part of that, we set up an Inequalities Data Development Group, as we called it, with analysts and interested people from across the organisations that kind of make up the partnership that are involved with delivering Making Manchester Fairer. And that kind of was our initial starting point with some of this, a group that we kind of brought together to kind of work through and kind of share tools and techniques for kind of how we might measure inequality, not just in terms of health, but in terms of housing or in terms of climate change or any aspect of any of those themes of Making Manchester Fairer. And that was the kind of way we kind of initially got into people. I think the fact that they were participating in something which would eventually be published was an important thing. They weren't just asked to participate in a theoretical thing. And obviously making sure that they kind of got acknowledgement with line managers and other kinds of things to make sure that their participation was something that they could include in their kind of general work plan and their kind of end of year review in terms of what they've done, and generally got very good and people were very happy to help us with this.
Brilliant, thank you. I think we have a question through, Bianca.
Could you please explain a bit more on the definition and measures you used for inequality in the toolkit? What was the selection process like?
So in terms of the measures, as I've said, in terms of if I can kind of go back to the kind of modules. So as I say, these are very much based on the kind of description and the sorts of things which were in those two tools which I've mentioned. So the old Public Health England tool that was, and the Scottish PHO. So we took those as our starting point. There's nothing wrong with the content in those whatsoever. So we used those as the starting point, but just updated them as a training kit from what was essentially a fixed spreadsheet, or in the case of the Scottish Observatory, a report, turning it to something which is more interactive. So we haven't necessarily developed the framework ourselves. We've used that framework from those established best practice, but just turned it into a more up-to-date, modern, interactive training package, and put more by way of local examples and more up-to-date examples in there.
Great, thank you. Oh, yeah, let me just bring the microphone to you. Hang on a second.
Thanks. Hi, I'm James from DHSC, and I was wondering, so this seems to be a toolkit mainly for analysts, who then presumably have to explain complicated things about inequality to policy colleagues. Is there anything in here about how you sort of communicate those complicated questions or those complicated findings?
Yeah, I mean, I say the toolkit itself, in trying to make it as easy as possible for analysts to be able to understand what a particular measure is. Those same kind of things can make it as understandable for the audiences as well. We haven't quite got into the kind of business about other users beyond analysts yet, in terms of how this might be used by, as I say, members of health and wellbeing boards, or those types of people who might get reports that have this sort of information in it. That's probably our next stage in terms of thinking about that, really. But we do, as I say, the toolkit uses examples. It uses ways of describing stuff. So we describe Manchester as a garden ecosystem, for example, as a way of illustrating how lots of different things kind of contribute to the overall ecosystem. So we try to use analogies and things like that to make it as easy as usual for people to look at, rather than it being a straight translation of what might be a stats textbook, I suppose. Okay.
Hi, Neil. Slightly embarrassing because I am also James from Department of Health. I work for the local Knowledge and Intelligence Service in the East of England. So it's really an observation more than anything. First of all, thank you. I've got to do something on measuring health inequalities in the East of England for our region. So I'm just going to steal from Manchester's Measuring Health Inequalities Toolkit. But it made me think about a couple of things, and mostly about what we were discussing earlier about how do we change siloed geographical working into this is relevant for you all. And I wonder how many people come across the Manchester Measuring Health Inequalities Toolkit and go, oh, right, that's measuring health inequalities in Manchester, rather than that kind of measuring health inequalities using Manchester as an example, and how we communicate that better. And I guess my observation is to thank you, because the first step to that is sharing. And we're not very good as analysts in sharing and stepping up and saying, we've done this and these are our challenges, these are our lessons learned. So thank you. I mean, it's a bit of a rubbish question, but because I don't think there is a question in there.
Yeah, I mean, I think your first point is a very fair one, and that's something we could possibly take back in terms of it being a measuring inequalities toolkit rather than a Manchester inequalities toolkit. I think the other thing is, and this came as much from the university as from us, one of the conditions of getting the funding, I suppose, was that it is on the university's open access training portal. It's not hidden away. It's not something you have to have a username or an account for. You don't have to have an NHS net account or a university password. It's open access. Anybody can access it anywhere. And also the fact that it's not, I think part of the conditions of that is that it isn't formally, what's the word I'm looking for? You don't get CPD points or anything like that. At the end, there's a quiz. So you have to kind of sacrifice that little bit from it. But it is open access. You don't need password. Don't need any hurdles or barriers to access it. And also, it's something that you can come back to. So once you've completed it, you don't need to complete it in a particular order. You don't need to complete it within a month or anything like that. You can come back to it if you remember a few weeks later or a few months later. Oh, there was something in that. You can come back to it. So we've tried to make it as kind of as usable as it possibly can, and in such a genuine tool for anybody to kind of use, not just for health, but for looking at inequalities in housing or in any other of the social determinants of health Whether we've been successful in doing that will depend on the feedback we get, obviously.
Great, thank you. And I think we have one more.
One last question, I think. Is the toolkit depending on a minimum range of data sources being available?
That again, sorry?
Is the toolkit depending on a minimum range of data sources being available?
I say the toolkit is kind of independent of data sources. I suppose the idea was that any individual analyst or someone could say, I've got this sort of data, what is the most appropriate measure I can use for looking at inequalities in this sort of data, whether it's individual record level data, aggregate data, continuous, whatever the data source is. The idea is what's the most appropriate measure to use for that particular data source, rather than using one particular data source and saying, what do I use for this data source? So it kind of starts with what data have I got, and what's the most appropriate way of looking at it, rather than from saying, here's all these here's a specific data set, I suppose.
Great, thank you. I think just one last point. You mentioned about evaluation. I just wondered if there's anything that people here at the conference can help you with that.
Well, I mean, as I say, anybody that kind of goes off and does it after this, if you would be, happy to kind of, I'd say, firstly complete the evaluation at the end of it. Obviously, it's not mandatory if you would. And then there's anyone that's willing to give us your email address as part of that, we will come back to you after 6 months and do that kind of further test of it. And hopefully, refine and refresh the toolkit in light of that. So, and the more people that kind of use it, the more, the better we can kind of, we can justify the time and effort that's gone into it as well. So that would be great. Thank you.
Brilliant.